All right, as people are coming into the room, I want to welcome y'all to our webinar today. This webinar today is part of the Within the Framework webinar series presented by the National Center for Pyramid Model Innovations. My name is Mary Louise Hemmeter, and I'm going to be the host today, although our guests are going to really do the bulk of the talking. Our topic today is guiding providers in supporting the social emotional needs of young children during the pandemic and other traumatic events. So with that, I'm going to move into the webinar for the day, and I'm going to just let everybody introduce themselves really quickly. I'm Mary Louise Hemmeter, and I'm at Vanderbilt University, and I'm one of the faculty on NCPMI. Nikki.
Hi, everyone. My name is Nikki Garo. I'm Director of Early Childhood Health Programs at Child Care of America. Turn it to Rose.
Hi, everybody. I'm Rose Schufelt. I'm the Director of Health and Social Emotional Wellness at Child Care Council in Rochester, New York. And I'll turn it to Jamie.
Hi, I'm Jamie Trampty Brassfield, the Early Childhood Manager at Family and Child Care Resources of NEW in Green Bay, Wisconsin.
Thank you. I'm very excited to hear from all of y'all. I'm going to do just a few little kind of setting the context things. Nikki's going to do the same, and then we'll hear from the rest of our panelists. So I wanted to just kind of set the context for why we wanted to do this webinar today. So we obviously we're coming back from the pandemic. Well, some of us are coming back from the pandemic, and there's a lot of anxiety. There's a lot of concerns among caregivers and families about what it means to be back in school, or maybe to be in school, even if children have been in school during the pandemic. But we've got some data. So some people have been doing some data, been doing some studies the last 18 months or so to really figure out how the pandemic has impacted families. And what families are reporting is that it's had a negative impact on the family in the sense that it's caused some negative moods, poor sleeping habits, and uncooperative behavior from children. A national survey that was published in the Journal of Pediatrics found that over a fourth of families reported that the pandemic had had some kind of negative impact on children's mental health and that problem behaviors had intensified. And the families who reported being the most impacted by that were families of very young children. So we know that families are dealing with these issues, right? Families have anxiety about this. And so what does this mean for us as programs? One thing we want to kind of reflect on is when children are experiencing things like the pandemic, are experiencing other kinds of traumatic experiences, there are kind of some pivotal things that we need to think about in terms of providing a safe, nurturing environment for those kids. And so one thing we've thought a lot about is that children are coming back to school with big emotions, and whether they've been out of school and they're coming back to school, or whether they're coming to school for the first time, children are gonna come to school with big emotions. And those could be they're excited, they could be they're scared, they could be they're anxious. And we have to be really thoughtful about how we're ready for that, right? That we just are going to expect that children are coming to school with these big emotions. And we want to create a safe space that says, we know this is hard, we know this is scary, but we're going to create a safe, nurturing place for you. Children are also going to come back to school or to our programs, and the routine's going to be different than the routine they've had being at home, or maybe they're coming from a different program. And it's going to be really important that we help children learn those routines, right? That we don't just expect that children understand what it means to be in our programs because they've been there before, because they might be coming after some time off. and they're definitely coming with a little bit of heightened emotions. And then the other thing that I heard a parent say the other day, I have a COVID child. And when I said, what do you mean by a COVID child? She said, a child who hasn't been around other children for a year and a half. And so think about what that means for children who have spent the last 18 months of their life in a caregiving arrangement that might be real one-on-one. And now we're going to put them in a classroom with 6 or 8 or 10 or 18 other children. And how do we support children to know how to be with other children? And I think one thing that will set us up to fail is if we expect that children who have been in our programs before are coming back with the same skills, because they're probably not, right? They're coming back with a new set of concerns and anxieties and emotions. So, so if you think about what we know about trauma-informed practice, or if you think about what we know about good developmentally appropriate practices for young children, it's all about relationships. It's all about creating environments where children feel safe and secure and they're predictable and children know what to do in those environments. And then it's about helping children develop and use their social skills and identify and develop ways to respond to difficult emotions. And all of that maps right on to those things that we know are creating some anxiety as a result of the pandemic. So we're going to focus much of our time today on the pyramid model, which is a model for promoting social emotional competence and preventing and addressing challenging behavior. And the pyramid model maps right on to those pivotal practices that we were just talking about. The model maps right on to the need for nurturing and responsive relationships and safe and predictable environments and targeted supports around social emotional competence. But it also is a model that says when kids need something more than that, we have something in place for that. And the last thing that it says, and that I think is really important, is the pyramid sits on an effective workforce. And what that means is that we also need to support the base of the pyramid. We also need to support the adults. And one of the things I've been thinking about a lot after the pandemic is that our teachers and our teaching staff and caregivers are coming back with the same anxiety that our children and families are coming back with. They're anxious about their own children. They're anxious about their own health. They're anxious about their own families. And so I want to kind of close my little part out by saying, let's approach this from a state of grace, which just means let's give all the adults we're working with grace during this time. Let's assume that everybody wants the same thing, which is a safe, predictable, early learning setting for children. But let's also assume that adults are going to need support too. It's not just the children, but that the adults are going to need support. How do we help adults remember the joys associated with teaching, right? Because it's going to be really easy to get hung up on the stress, but let's also key into why we're doing what we're doing. Let's assume that even adults challenging behavior is telling us that they need some kind of support. And let's be okay about when adults ask for support, because just like the children are going to need extra support during these times, the adults are going to need extra support too. So I'm going to kind of turn it over to Nikki at this point to talk a little bit more about her work.
Hello, everyone. As I mentioned, I'm the Director of Early Childhood Health Programs at Child Care Resource Referral. So I just wanted to take a little time to talk about why we wanted to partner with NCPMI on this webinar in our work for supporting the childcare system during the pandemic and also a variety of other traumatic events that we've all experienced in one way or another over the last 2 years. Next slide, please. So first of all, I know we have some of our members participating in this webinar today. But for those of you who are not familiar with us, Child Care Aware of America is a national membership organization. The majority of our members are comprised of more than 400 state and local child care resource and referral agencies nationwide, and which we usually call CCR&Rs, and we have two of those that are going to speak with us in a little bit. So CCR&Rs provide a variety of services depending on where you live, including childcare referrals and other parenting resources, childcare provider trainings and technical assistance, and also are engaged in a multitude of other efforts to increase the quality and availability of childcare. And we were founded in 1987. We advocate for childcare policies that improve the lives of children and families, and we lead research that advances the childcare and early learning field. We also leverage technology to help families make childcare decisions, and we provide professional development for childcare providers and CCR&R staff. And our number one goal is to support CCR&Rs in their work at the local level to support the childcare system. So next slide, please. So as Mary Louise went through a bit already, what's our collective experience in the last year and a half? We're still in the midst of a worldwide pandemic. There's been massive disruption in routines. I don't know about you, but I'm still working from coming to you from my basement right now. We have experienced long-term isolation. On top of that, we have several natural disasters related to wildfires, hurricanes, et cetera, that also disrupt routines in extreme ways. We've had widespread civil unrest due to some reckoning related to the racial injustice in our country, as well as opinions about the election. We've seen it all, right? So now, as we've discussed, we're returning to or starting school. Some young children have been in care this whole time, but they may have been in several different care situations over the last 18 months as work routines are changing for their parents and caregivers. And so what are ways that we can support the various stakeholders here, providers, families, and children through all of this? So next slide, please. So to kind of just put an exclamation point on what Mary Louise went through, families are suffering. In a study of families and parents and caregivers in Massachusetts, 66% of families were worried about the pandemic. Nearly 3/4 were concerned about health. 70% were concerned about future well-being, and 72% were concerned about work-family balance. And we know that low-income families are 4 times more likely than high-income families to say the pandemic has caused financial stress. And of course, we know the variety of reasons for that. High-income families may have parents that are still just working from home. They have kept their jobs, they're still together, whereas in other situations, there's changes in jobs, a lot more disruption in routine and access to resources. And we know that at the extreme end, that children in the lower end of school age have had increases in emergency department visits related to mental health. So next slide, please. So that's why we are very excited today to be talking about the pyramid model as a way to support providers, families, and children through all of this. Throughout the pandemic, we've put out a variety of resources related to addressing emotions and promoting wellness, as well as putting an emphasis on self-care for providers. We've done some trainings for CCR&R staff and providers related to self-care in areas affected by wildfires. And we think the pyramid model really is a good way to organize all of the information that's out here about how to support the childcare system and the various stakeholders involved. And finally, I know Rose is going to talk about that as well, but we are very supportive of the infant and early childhood mental health consultants as critical to supporting social emotional health for young children and their families, as well as providing providers with tools to process their own feelings when they're in the early learning setting. So with that, I think I will turn it over to Rose to get started so you can learn more about how it's getting implemented in New York.
Thanks, Nikki. Hi, everybody. Again, I'm Rose Schufelt. I am the Director of Health and Social Emotional Wellness at Child Care Council in Rochester, New York. I am also the Region 2 Mental Health Consultation Director, so I oversee our mental health project for our region, which covers 9 counties. And I am also one of the Pyramid Model Master Trainers and Coaches for our state. I was one of the 50 original Master Cadre Trainers and Coaches. And I also oversee our pyramid work in Region 2. Specifically for me, what I do within the CCR&R is my department is made up of 4 separate components, but they all support a whole child approach to wellness. So I oversee our registered nurses. So we have healthcare consultants that work with our providers doing medication administration training and also serving as that program's healthcare consultant of record. And usually when a kiddo is experiencing challenging behavior, that is the first place we start to see if there are any medical issues that might be causing challenging behaviors. Then one of the newest components to my department is our infant and early childhood mental health consultants. So that just started not too long ago, back in, well, 2 years, coming up on 2 years now. And each of the CCR&Rs across New York State have mental health consultants as part of their teams that can go and work with providers within the programs, providing technical assistance, training, supports, etc. And then a big part of what I do is implement pyramid model within programs across New York, well, in Region 2, but I support programs across New York State. And I'll talk a little bit more about that. And then another big thing that we are extremely lucky to have on staff is a special needs coordinator. So when we think about the top of the pyramid, we actually have somebody on staff at Child Care Council who is able to provide technical assistance, support, training. We can even buy equipment for providers that are serving children that have some of those special needs. So special needs such as autism, et cetera. So all of our department works closely together when we're trying to determine what are we going to need to help support that program, teachers, family, children, et cetera.
Hey, Rose, I hope you don't mind that I jump in. So
No.
where does that special needs funding come from?
So we have a OPWDD, which is a specific entity in our region, actually our county, that supports that project.
All
And
right.
then we have other pieces to our CCR&R contracts that help
Got it.
support that.
Thank you.
Uh-huh.
Oh, let me go on to your next slide. Whoops. There we go.
So New York State came to implement Pyramid back in 2016. A survey was sent out to all child serving agencies, and the results of that really were about understanding and that children's mental health is still the #1 concern. And we really needed to figure out how do we support early care providers in all settings in supporting children with challenging behaviors. And the ultimate goal really was to eliminate suspensions and expulsions around children that were having challenging behaviors. And as you can see from the slide, there was a large number of children being asked to leave programs due to challenging behaviors. So as a state team was established and developed to really tackle this. And when looking at what projects are out there, what frameworks are out there, we decided as a state that Pyramid was what we wanted to do. And the ultimate goal for New York State is to have Pyramid model implemented to fidelity across all child serving programs. Specifically, we started with early care programs, child care programs in all modalities, and we still really work with those programs, but we're also trying to do some cross-sector work and really seeing how we can include other child serving entities within this framework. New York State started that leadership team that I talked about and created a guide, our implementation guide, and did a lot of work. Number one being hired or trained 50 folks across the state as master cadre trainers and coaches. And I have the privilege of being one of those original master cadre. So that is how the work started and has grown from, I think it was maybe 25 programs to start with that have been implementing Pyramid within that first year to, I believe we're up past 60 programs that are now implementing. It might be even a little bit more than that. Within that growth, what happened was New York State decided that they needed some help with supporting programs and reached out to the CCR&Rs and created what we call pyramid model hubs. So what my CCR&R is one of those hubs, and we have 5 currently across the state out of our 7 regions. And really, we are there to support our programs within our regions, specifically around pyramid practices. And those hub responsibilities include creating a community-wide leadership team. So we really have cross-sector representation across our region from folks in all entities that serve children. We recruit programs for future cohorts. So looking at training and assisting with the readiness. So we train the pyramid model modules. We provide supports through coaching and any supplies and things that we can do to bring to programs to really help with that implementation. And then we hold the 2-day kickoff for implementation. And then we collect data, and that's where our tie back to the state comes in. And we work closely with the state leadership team to make sure all of the data is collected around assessments, et cetera. Through this work, we also in New York State back in 2019 put a team together around trauma and being trauma informed and really thinking about how we can help support programs. And one of the things that came out of that work group was really thinking about how we could support CCR&Rs to become trauma informed across the state. So that is current work that we're doing. And also within that was our idea of being able to hire infant and early childhood mental health consultants. But all of this works closely and fits perfectly within the pyramid model framework. So everything that we've kind of done leading up to this point fits within that framework and builds upon each other. And that's where our mental health consultants have been hired. So huge, huge accomplishment for New York State. And that came out of our lead person really advocating for infant mental health consultants, Patty, and I think she's on there. But we are so thankful for Patty Purcell in being able to advocate for us to get infant mental health consultants, and they are housed at our CCR&Rs. We have over 35 in the state, and they are able to go into programs really intentionally and help families, children, staff, really supporting trauma work and anything surrounding mental health. And we're about a year into that project, as I said, and have had huge success. And for us, particularly in our region, every single program that implements Pyramid is paired with an infant mental health consultant. And that really is hopefully will trickle down into some of the other regions in our state, but it works perfectly. And we've seen huge change.
So, Rose, I'm going to ask you one real quick question. So a couple of people have asked about what are the qualifications for mental health consultants? do you have any, really anyone could respond to this, but do y'all have a certificate in New York, or what are the requirements for someone to have that position?
For us, I'll start and anybody can jump in, but for us, it definitely was a new thing, and that is not something that is it's not a general major for work.
Mhm.
So we really, in Region 2, hired folks that had a social work background. Actually, I have somebody that is an art therapist. And then they did not have to have, because it's not therapy, we're not providing direct therapy. They did not have to have their license, but we asked that they be licensed eligible so that potentially in the future, we are able to maybe provide therapy services. Another one of my advocacy projects that I'd like to see. So yeah, master's degree in social work related field as such.
Thank you. So Jamie, I'm going to toss it to you, but if you also want to just, if you have any thoughts about that, because that seems to be the big question everybody has. Who are these infant and early childhood mental health consultants? Feel free to answer it or just jump right into your slides.
I feel like that's a lot to match, Rose. Geez Louise. We, in the state of Wisconsin, our university, the University of Wisconsin at Madison, does have a 10-credit graduate program for working towards your infant mental health endorsement. So that's, but at this time, this is not something that we have available across the state. We don't have infant mental health consultants statewide. We might have them in some communities, there might be some pockets, but it is not something that we're currently offering statewide. But we do have that graduate program. So if you live near Wisconsin and you're interested, it is a cohort program. It starts, I believe, in August, and it runs a school year. So yes, all right. Thank you, Rose. So now I'll talk a little bit about what we're doing in northeastern Wisconsin around the pyramid model. Click. Next slide. The service delivery area that I'm working with is, again, in northeastern Wisconsin. We have 7 tribes, we have 7 counties and 3 Native American tribes with a population overall of just under 500,000 people. So we're pretty spread out here. We do have 204 regulated childcare programs, and many of those are in communities where there is 1 or maybe 2 childcare programs in a community. And of all of those 204 programs, 64 of them are programs that are family programs, most of which doing care in their home where they live with their family as well. Next slide. When we start looking at the pyramid model, a lot of the work that we're doing right now is tied to training. We offer 4 different trainings. And again, that's what we're doing here in northeastern Wisconsin. We have the 8-part series. We are also doing the infant and toddler 8-part series. We also have another training called Promoting Mental Health in Young Children, which is geared for Head Start staff, our 4-year-old kindergarten, our 5-year-old kindergarten, those teachers, and also the paraprofessionals that are working in those classrooms. And that training is very similar to the Pyramid Model 8-part series. We've added some more science around brain development. So we've taken that 8-part series and just kicked it up a notch. And then we also utilize the e-modules from NCPMI, and we have added reflective coaching, and that can be done either via email, phone calls, and with COVID, we also offered that virtually via Zoom calls. We would offer that where a group of people who were taking the e-modules at the same time could call in and discuss what they were doing, how it was working, the challenges they were experiencing, the successes that they had, and then also the action planning. All right. Oh, actually, I do have one other thing to say for the last slide. As far as implementation goes, we have a couple of sites that are implementing the pyramid model to fidelity. And again, in this part of the state, they are primarily tied to school district programs. They tend to be 4K classrooms or Head Start classrooms. A lot of our childcare programs are working on getting their staff trained. And I'm sure, like many other people on the call across the country, we're experiencing some challenges around staffing, retention of staff. So many of our childcare programs have hesitated to go to implementation because of their inability to retain staff. All right.
I mean, that's the big challenge, and part of the work I know that a lot of people are doing out in states, which is not just how do we get people trained, but how do we, once we've gotten people trained, how do we onboard new staff, right? So
right.
Starting right at the beginning. So
right.
Yeah, let me go on to your next one.
Okay.
Always have something to add.
Hey, that's okay. So one of the pieces that we have done, because we've struggled with getting programs to buy in, not to buy in, but to really fully engage in implementation, is we have started providing our training participants some tools that they can use in their classroom to help bring the pyramid model to life, again, in their space. And really not just, yep, I attended a training, but actually I'm utilizing those skills that I have learned in the training by implementing this in my work and by making this come alive. So in addition to some of the commercial tools that are pictured here, we also have provided mirrors. Again, especially when we're talking about infants and toddlers, we want things to be age appropriate and developmentally appropriate. So mirrors have been used. We also have provided books, and we've done board books, we've done storybooks, picture books, and really trying to make sure that the books that we have are culturally relevant and appropriate for all of our communities as well. We also have used the book nooks that are available through the Pyramid Model website. We also have done laminated color copies of the problem solving toolkit, which that is a hot item. When we get that, people are so excited to have their laminated color copy of their toolkit. And then we also have done copies of some of the scripted stories that, again, are available through the Pyramid Model websites. There we go.
All right. So, I mean, Jamie, you brought up a really good point here, which is that, you know, the pyramid was never designed to be like a curriculum where you buy the box and you have everything and you go and do it, right? But what we have found is that if we can create ways to help teachers gather relevant materials, or if we can give them some visuals, or if we help them find the time to make the visuals or whatever, that we really do get implementation more quickly. And so I'm really glad you brought that up. Before I go to some general questions, I wanted to respond to one other question that was in the chat, which is someone was asking how you measure fidelity. And so we think about fidelity in the pyramid work in two ways. One is, our classroom staff implementing the pyramid model with fidelity, right? So when we talk about, are they doing it with fidelity, we're talking about our teachers implementing those practices with fidelity. And we have tools, and I think Ashley can stick some links in the chat. So the teaching pyramid observation tool, you'll hear people refer to it as the teapot, and the teaching pyramid infant toddler observation system, which you'll hear people refer to as the tippy toes, are the way that we measure classroom implementation. And then we also have tools, and you can find all these tools on our website, for measuring whether programs are implementing with fidelity, meaning are programs implementing the supports that staff need to be able to implement the pyramid model well. So there's fidelity that we talk about at lots of different levels. Okay, I have a few questions for y'all. Thank you. That was a great overview, and people are loving your all's really concrete examples of what you're doing. So Rose, I'm going to send this question to you to start with, and then Jamie, you can chime in too. So y'all both talked a little bit about trauma, and certainly, I mean, it's hard to imagine a period of time where a group of families might have experienced trauma from more different directions than what's happened in the last few years, as Nikki so well articulated. And I'm wondering what programs have kind of shared with y'all about trauma and how you see the pyramid model as being a way to address some of those issues related to trauma. So Rose, you want to start?
Sure. So I think one of the biggest things, there's two major areas that have come out of my work within programs in Pyramid. One, Mary Louise, you alluded to right at the beginning with COVID babies or COVID children. And that truly is something that we are seeing as well in New York. So I'd put that under attachment irregularities and just the trauma of wearing masks and babies not being able to see faces. So specifically with that, pyramid model, obviously it focuses on relationships, routines, reliability, reliability, and helping children form those attachments with having somebody that's consistent and responsive and that really supportive relationship. Another thing that we are definitely seeing through all of this is particularly with staff and staff wellness, which has been a huge piece to the work that we've been doing just over the past year. And particularly a lot of trauma that providers have experienced that are being triggered by child behaviors. Mm-hmm. So I think specifically around pyramid and how that fits is teachers are really feeling supported within the whole team approach to pyramid and really being able to look at the causes of the behavior in depth and really sorting out the whys around those behaviors. So what is the causing the behavior, and then how do we support that kiddo with a team approach? And the teachers are feeling much more supported. So there's a lot that plays into that, definitely.
Yeah, and I think, we've from the very beginning felt like, and the reason it's at the base of the pyramid, we've always felt like if we're going to do the pyramid well, we've got to support teacher or providers, right? I mean, we can't, if we're going to say you have to be responsive to kids and you need to, see what the child's behavior is communicating, we need to do the same thing with adults, right? And certainly the pyramid gives adults strategies to use with children, but the support that we try to provide also gives them, I think, the motivation as well. Jamie, did you have anything you wanted to add to that?
I think my answer really goes right along with what Rose was talking about. We, the staff here in my office throughout COVID and with everything else that's been happening, we have really embraced the practice of building relationships and supporting and listening to the child care center directors that we talk to and the administrators. And in turn, right, by us supporting them, then they're able to support their staff, again, really building up that effective workforce. And we've talked about it with our staff and with the directors that we've been talking about or talking to, that this really is a parallel process, right? That we're providing you that support so that you can provide your staff that support, so your staff can in turn support their children and their families. Because again, if you as a teacher don't feel supported, there's no way you can do this challenging work. And the other thing that we've done, again, really around the strategies tied to the pyramid model, really looking at those visual schedules to help increase predictability and help teach kiddos what's coming next and how to get ready for that.
Yeah. Jamie, something you said in a question that was in the Q&A was around, or chat one was around staff turnover and around director saying something, I'm paraphrasing for sake of time, something about I can't lose a staff over a kid, meaning, and this was around a suspension expulsion issue that, if this, that one was, that but those two things are related. And I think that around suspension and expulsion, that if we believe that the weight of that is on the teacher's back, then we're not going to be successful, right? But if what we say is, as a program, we want all children to be successful here, then that's a commitment as a program to support that adult and to support the child, not to say the teacher has to do it or the caregiver has to do it, right? But as a program, we're going to figure out how to help that child be successful there. And that's when the pyramid works, right? Is when adults feel like people are saying, we're in this, we're committed to this, and we're going to give you the support you need to do it well.
Right.
So,
I think, right, it really does come down to the support that, you have this happening in your classroom, and we're going to help you figure this out. It's not just you, the teacher, having to figure this out on your own. We've got your back. We're going to help you, and we're going to work through this because, again, we value that as a program. We want our children to stay here because we value that consistency. And so we, as a group, are going to support you.
Yeah, absolutely. So, Jamie, just kind of along with that, I'm wondering what kinds of things that have you heard from programs about the outcomes they've seen because of doing the pyramid model? And those could be children, families, staff outcomes. What have you heard from programs?
I think this is Rose's question.
Oh, you do? Sorry, Rose, this is your question.
This one's Rose's.
It takes a team, right? It takes a village. Go ahead.
Yeah, so for us with the outcomes, there's so many, from following up to what you were just talking about, Jamie and Mary Louise, on suspensions and expulsions particularly. We have found that programs are less likely to suspend and expel right off the bat, especially when they are implementing pyramid practices. So they will take the time to work as a team and their behavior support team, et cetera, really see if pyramid is being implemented to fidelity and really work towards the goal of helping children succeed along with staff. So less staff burnout, less staff turnover, definitely have been on the forefront. And then in addition to that, programs have found that there is so much more family involvement when they're implementing pyramid, which we know is a huge piece to pyramid implementation. So just having families involved right from the start and knowing if they're going to get a BIR or what that means and what does that look like, and being a part of the solution and really figuring out preventative aspects as well. So those are two. And then we have seen a ton of children in foster care lately, and there's been that piece of the transitions, basically going out of the program at some point to visit biological parents, coming back. And this is a very specific example, but having a child that really was struggling and having big emotions and really needing supports around transition, and being able to implement some of the targeted strategies have helped tremendously. And then being as a hub, going back to our work as a state, I've done a lot of work around bringing in those service providers. So really tying in foster care, teaching EI services about pyramid. What does that look like? What should you be doing? And it's been a huge success to have that cohesiveness across services.
So I love all of that. And it's really also is responsive to a question which someone is asking, where can you do this? And I think the answer is you can do it in any program that serves young children, right? And so it could be Head Start, it could be childcare, it could be family childcare home, it could be home visiting programs, it could be whatever. So thank you for bringing in that foster care example. Okay. Jamie, I'm going to go to you really quickly now because I know I'm supposed to go to you now. So another question we've had, and we're a little prepared for this one, is about school readiness and children, children who have come through the early childhood years during COVID, not being ready for school and the need to kind of work on more pre-academic kind of things. And yet we're sitting here talking about social emotional. So I think, have y'all thought at all about how you're guiding programs to kind of balance the school readiness, pre-academic need with just helping children be socially and emotionally ready for school?
So we're really focusing our conversations with child care programs on the social and emotional side of things, knowing that when we look at academic achievement, you know, kiddos who score higher in social and emotional skills when they are in the early childhood years do tend to have better academic outcomes. So that's, I mean, kind of one of our big data points that we really push. Is that, again, kiddos can't learn if they are not ready to do so. So we really want to focus on getting them socially and emotionally ready for school. You know, talking a lot about peer interactions, how we can intentionally pair children with other children to help them, again, learn to play with others, because for some of those COVID kids, that hasn't been their reality. Mm-hmm. So really looking at that, and also then again, going along with that, the importance of play and how we kind of sell play to parents. Parents aren't always aware that play is important. And so we talk a lot about how play happens and how we teach children to play, because it doesn't always happen naturally. So we talk a lot around supporting play, and again, just building those social and emotional skills, because when they're ready, they will learn their alphabet, they will learn how to write, but we have to build those foundational skills first.
Perfect.
Can I just add something, Mary Louise? I don't know what time we have, but just kind of following up on what Jamie said. Part of our survey, we actually surveyed hundreds of kindergarten teachers, and just what you said, Jamie, from that data, that is exactly what our kindergarten teachers said that they need children to come to school with, are those social emotional skills. And then when I'm teaching pyramid modules, I always make a point of giving examples such as you can teach math skills within problem solving. And I always use the example of coming to lunch, and you have 7 children coming to lunch. So you go to the table and you only have 6 chairs. So you say something like, we have a problem here. We have 7 children, let's count. We only have 6 chairs, let's count. We have a problem here. What can we do to solve the problem? Listen to what the children are saying, but not only are we getting problem solving, but we're getting math as well, right within those pyramid practices and the social emotional skills. So doing things concretely for the teachers when they're learning is so important. And then that really hits home for them.
I love that example. I love that. Well, we are actually pretty near the end of our time. And so I'm going to ask Rose, you first, and then Jamie, you. Like, if you had, let me just get us to our next slide. If you had one piece of advice around supporting programs, what would it be?
For me, it's go all in. And, you know, I started this work back in 2016. You have to have somebody that's your champion, whether it's from us at a CCR&R level or in a program itself. Is who is that person that loves pyramid, loves this work, that is going to champion for it. And then everybody needs to be trained in pyramid model. I think every single person, every CCR&R staff everybody in the state should take pyramid training. It's just the best and really sets that foundation. And then for us to start, there's not a lot of funds. So a creative way that we started, especially for myself and our CCR&R, in the beginning of this project, there were not funds supporting, or very little, very minimal funds that were supporting the work. And we just worked it out where we were able to put the work within the context of what we were already doing. So as a CCR&R, embedding it within our infant toddler project, our education, our TA, all of those milestone numbers that we needed to meet. Pyramid became part of that. And then advocate for statewide pyramid. If your state is not doing it, you have to be. I don't know what else to say. It is so important. And the work, you could just see it. You could see it working.
And I'm looking at the list of participants, and many of them are from states that are doing pyramid statewide. So let us know if you need help connecting with them. Okay, Jamie.
Mine really was, I mean, I agree with everything Rose said. That was like the perfect list. I go back to connect with the children in your programs, connect with their families and their adults, connect with coworkers, connect with your leadership. This all is, we are so relationship based in our work, and this is what has to start here. And I think some of this even can tie in with what Rose was saying. You know, when we talk about advocacy, are you connecting with your legislators and talking about the funding needs? Are you connecting with the leadership of a child care program to say, this is important work and how can we make this a priority? So really going back to connection, connect with everybody, do it.
We always say it's all about relationships. So it's all about connections, right? So Rose and Jamie, thank y'all so much. And I am going to turn it over to Nikki. Nikki's going to do a couple of things. She's going to do kind of thank you. But also I wondered if you had anything else to say about the mental health consultant issue that people were bringing up, and just the variety of how states approach it.
Yes. So to answer the question, I think somebody had asked Rose what the credentials were of mental health consultants. And as with anything in childcare, it varies widely by state and in some cases county. So in some states, it requires, similar to New York, where you have to be license eligible. But in other states, it may be a child care program leader that just has a lot of experience working with children that have challenging behaviors, and through their experience, they've gained skills. And there might be a social worker or someone that's supervising a group of people like that. But depending on the state and kind of what their goals are, they might design it differently. And as we know from the pyramid model, depending on what the provider's kind of credentials are, is kind of where they fit within that pyramid. So kind of I'm a public health person. So on the broad part of the pyramid, where you might be trying to do like a population-based, that's where you might not necessarily need a PhD in psychology to to provide intensive therapy services. But maybe, you know, if Rose gets her wish and has all licensed mental health providers, she'll be able to move further up the pyramid, like within her program. So it just depends on what the needs are of the population. But I just wanted to note that every state kind of does it differently. Just like with child care, the states that have child care health consultants also do it differently. In some states, they have all public health nurses. In other states, they're health educators. In other states, they're CC&R staff who just have a lot of experience with health related services. So just depending on the states, kind of how they design the program, it differs quite a bit. There are guidelines. I think somebody put the Center for Excellence in Infant and Early Childhood Mental Health, and they do have guidelines on what they suggest, and they do suggest licensed mental health providers. But I just wanted to note there are different models depending on funding sources and how your different programs are designed. But finally, I just want to say thank you everyone for coming today. This has been, really enjoyed it. I'm really happy that 2 of our members, CCR&Rs, were able to highlight their work with the pyramid model. And I'm so grateful that you all joined us today. And I'm sure that I'm going to be sure to spread this back out to our membership so they can watch the recording, because this is great. So just thank you so much. And I'll turn it back over to Mary Louise.
Nikki, you might be able to talk faster than anybody I know, but thank you for doing that. And we didn't save you a lot of time. So I want to say a couple of things. Thank you, Nikki, for working with us on this. I mean, it was just exactly what we wanted to do, and we appreciate you. And I was thinking how proud you must be to know this work is going out and out in the CCR&Rs. In a minute, we're going to put up the website for challengingbehavior.org NCPMI website, but I just want to say a couple of things. This is just an example of a resource, but lots of people are asking about resources we have or that the R&Rs have, and on NCPMI, we do a quarterly webinar series around coaching, and we do this quarterly webinar series. And if you go to NCPMI, you can find all of those. They're all archived. You can type into the resource section, search a term, and it'll bring up whatever it is you want to see. So just know there's a lot there. We will post this PowerPoint on the resource page. So some people are asking for me to back up on some slides, but that would make people dizzy. So I'm not going to do that, but we will post it and you can go to our website to get it.
All right. Thank you very much to all of our panelists for their wonderful insights. Your feedback is very important to the work that we do. Please remember to provide your feedback on this webinar with our post-webinar survey by typing the web address shown on this slide into your internet browser. Your certificate of attendance will appear once you submit the survey. We invite you to visit our website, challengingbehavior.org, to sign up for our upcoming webinars, access recordings, download pyramid model resources, and more. Thank you to our funder for making this webinar possible. This concludes our webinar. Thank you all and have a great rest of your day.